on the Hill this morning. Coming up, we're going to continue with our discussion about mental health in regards to how we approach the stimulus bill. Joining us this morning is one of the experts in that area, Dr. Lucy McBride. She is an internist, and she joins us live on the Hill this morning. Dr. McBride, thanks for taking the time in speaking with us. You know, so much of the discussion lately, Doctor, has been about physical health, and obviously that is paramount. That is the central issue dealing with an infectious disease like this. However, you've been looking at it from a different angle, and a lot of people are experiencing a lot of issues right now with their mental health. What have you been seeing coming across your desk as far as how people are coping with this mentally?
Thank you so much for drawing attention to this very important issue. I'm delighted to be here this morning with you. So the way I see this pandemic is that it's not only a crisis of physical health, it's a crisis of mental health. So while not everyone will develop coronavirus, everyone that I am talking to, patients one by one, and then what I'm hearing from the public that I'm in touch with, is that we are all experiencing fear, vulnerability, and a sense of sort of feeling lost about what to do and very, very scared. So not only is this something that we need to talk about in terms of coughs and fevers and sore throats, we also need to address people's anxiety, the emotional symptoms they're experiencing, nervousness, worry. Some people are then behaving in ways that they wouldn't normally behave. People are turning to substance abuse habits that they didn't have before, or that are just accentuated at this moment. So my job as a physician is not just to treat patients for their physical issues, but also for their emotional health. And that's always what I've done with my patients. I've always believed that physical health and mental health are co-equal, that we are not delivering meaningful health care unless we're addressing those two essential components of people's health in parallel.
Doctor, I'm going to ask, as the discussions about the stimulus bill rolled out this morning, you know, obviously coronavirus has to be, you know, the beating heart of whatever that money is used for to fight this pandemic. But you know, you make this point that there's a very serious connection between mental health and physical health. Did you hear enough about that in the discussions leading up for this? And do you have any information as any additional protocols or facilities that are going to be available to physicians, psychologists, psychiatrists to deal with what's going to be an onslaught of these conditions?
Great question. So what I was delighted to see is that we passed through our federal government the stimulus package that includes a wonderful beginning to the process of helping people not only with the physical parts of this virus, but with their mental health. So $425 million have been allocated to mental health and substance abuse services in this country. I don't yet know how these funds and monies will be dispersed, but let's just say this is a wonderful start to our ability to heal our collective anxiety. So I think that it's promise, it's hopeful, and what's also really, really wonderful to see is that mental health is being recognized by the federal government as something that matters. My goal in my professional life with patients one by one is for them to see the link between their physical health and their mental health. And if the federal government can now endorse that as something that matters, we are on a gradual path towards understanding what health really looks like. So I was delighted to see those funds being allocated.
I want to ask you briefly, a lot of people are going to need these kinds of services right now, but might not feel that comfortable in going to an office. So are there other ways, you know, we're doing it right here this morning, are there other ways that are being developed for therapists to deal with people and to treat these kinds of conditions?
Well, what's fascinating to watch and what I'm doing with my patients is that telehealth is taking the front seat right now. So telehealth is now being used and deployed to patients who are rightly not leaving their homes because, of course, we're all supposed to be staying home when able. So we are using telehealth more than ever. And what's also nice about the stimulus package is that it lends monies to then be used to execute telehealth facilities so that people can have a doctor and ideally a therapist in their homes, if they have broadband, if they have Wi-Fi, if they have internet access, if they're fortunate enough to be able to do that, if they have a computer.
Right. All right, Dr. Lucy McBride, we thank you so much for discussing a very important issue here on the Hill this morning, and we look forward to talking to you again. Thank you very much.
Thanks very much.
All right, coming up next, there is a community in our area that is of particular concern right now. We are going to go live as On the Hill continues this morning on this Sunday, right here on Fox 5.